Hello everyone, welcome back to my channel. Today's video is going to be a 6-month update on my post-surgery. My cat is running around like crazy, so I do apologise if you can hear her. She's being a pain, trying to ruin everything, jump on everything and destroy my whole room. And also, secondly, my background has changed. I'm sitting in front of my desk. My whole room, I have completely turned it around. The only thing that is still in the same spot as where it was is my wardrobe because I can't move it. It's built in. And my tall boy is really in the same spot. Everything else I have completely moved around. I am looking at sort of doing up my room and making a proper theme out of it. So one day I will be doing a room tour, but not today. So yes, I have written down some basic notes. I'm recording my voice on my phone and I hope it all works, so let's jump straight into it. So if you have been following me since November last year, at least, you will know that I had surgery on November 24th and I'm going to explain what happened. So long story short is I had a septoplasty and a turbinoplasty because my turbinates, the little airbags in my nose, were way too swollen, so we had to reduce those, and my septum was basically a zigzag, so I had that straightened. My nose looks really crooked now. I don't really care what my nose looks like, but I can breathe. That's the main whole reason behind it. So yeah, I had that done, but at the end my surgeon gave me a injection of atropine, which is supposed to dilate blood vessels so you don't bleed. It did work that way, however it does raise everyone's heart rate, but I had an extreme reaction and I stopped breathing twice, and after that my heart rate stayed up at about 160 overnight and it was down to about 110 the next morning. They were giving me injections of something to try and slow it down, but that didn't work. So I had to spend all night with heart rate monitors, ECG things on, the blood pressure cuff, which took my blood pressure like every 20 minutes. So leave the fact I couldn't really breathe alone, leave that out of it. I couldn't breathe, I couldn't sleep because I had someone coming in and checking on me like every 20 minutes because I had to spend the night in the cardiac ward instead of just the surgical ward. So yeah. So this is my update on how I'm doing now and all the good fun stuff to go along with that. So I'm going to get down to the most important question which people ask, and that is, did the surgery work? And the answer is yes. I can breathe so much easier. I can smell again, or I can smell because I never really had a sense of smell to begin with. Here comes my cat. My nose is no longer discharging any sort of crap like it used to. Yeah. So I'm going to go through this list and tell you what is happening right now. So I'm no longer discharging anything for like a week or so. I had a lot coming out, and then after that I had to rinse my nose out with like that squeezy bottle stuff for about another 6 weeks afterwards. So yeah, about 2 months post-op I had to keep rinsing my nose out, and the highlight on the end of my nose looks really intense. I can't quite see my camera because I got my phone light on, the torch on my phone, so I can have some light because it's nearly dark. Yeah, so every now and then I do get some minor pain, mostly in the bottom of my nose on like here, but inside at about here. But other than that, no, nothing hurts anymore. It never really hurt that much anyway. The pain that I get is very minor. It's mostly just a bit uncomfortable. It's not even really pain. The numbness in my nose is gone because, not my nose, sorry, my 2 front teeth and my lip. I think I mentioned that my 2 front teeth in particular were very numb because the nerves that are in your nose are linked to the nerves in the top of your mouth. And when I first woke up, my whole top lip and pretty much my whole top teeth were completely numb. I couldn't feel it. And I'm very, very lucky. I have regained, I reckon, 99% of that feeling back, because about 40% of patients don't. They either don't regain the feeling at all, or they only regain it a little bit. And I'm lucky I got 99% of it back, because it would be hella annoying living with just your two front teeth really numb and everything else fine. But I've suffered no nerve damage or anything, which is amazing. My sense of smell, that's an interesting topic. There are things now... Oops. There are things I can smell now that I realised I had never been able to smell before, and one example of that is chocolate, chicken nuggets, and like flowers. Like flowers as in roses and stuff. A bad side effect to getting my sense of smell back is when I'm at work, all I can smell all day is our damn garbage bin. So yeah, it's a little bit gross, but I can handle it. So to go along with like getting the feeling back in my teeth and all that, my eyes are not as sensitive anymore. Particularly it was the wind and the cold that were really, really bad. I would absolutely hate cold days. Like, I mean the freezing cold days where you wear like 3 layers of clothes all day, don't even change out of them. I would say wait at the bus stop to go to school last winter. It'd be one of those freezing cold days. My nose would burn, my throat would burn, my eyes would literally make me just want to sit here and go like this, like all day. Completely shut my eyes, wrap my head in a towel nearly, because nothing would stop the pain. It would feel like someone's literally freezing my eyeballs. And I'm not getting that now. The weather's cooled down so much. It's like getting to the point where we leave the heater on nearly all day, and my eyes aren't burning like that anymore, which is amazing. I am rarely sneezing, which is something else I noticed. I think it all ties together. I'm rarely sneezing as well. I can go 3-4 days without sneezing at all, and that's incredible considering that I used to have like 20 sneezing fits a day, and that would take such a toll on my head. I would have such a headache by just the end of the school day, let alone at the end of the day. Yeah. So my sore throat has disappeared as well. I think I mentioned that when I was intubated, I had a student do it. And he or she, I don't know who it was, I just know it was a student. Whoever did it really, really, really scratched the back of my throat. Speaking of sneezing, I have to, hang on. There we go. He really, or she, really scratched the back of my throat, and I've noticed my voice has changed. People keep saying, on one hand, I'm not as nasally because I have enough air going up through my head. I'm not as mumbly, and I'm a lot louder. However, everyone says my voice is like kind of raspy, and it's almost deeper than what it was before. Not that I care if my voice changes that bad, but yeah, people have just noticed and told me. It's just something I've noticed. Yeah. So perfumes don't annoy me anymore, which is an amazing thing. I can actually wear perfume now without sneezing, crying, or whatever I used to do. That's incredible. My nose is very slightly sensitive when I'm applying makeup and things like that. So when I'm like putting foundation on my nose with my sponge, concealer, when I'm using my great big elf brush for powder, things like that, like, it's not that my nose hurts, doesn't even really feel uncomfortable. I can just tell my nose is a lot weaker than it used to be, so that's kind of a downside to it, but really I can put up with that for the rest of my life. I've got absolutely zero sign of needing any sort of medication or nose spray for my nose. Like, yeah, my nose is running because I've got a bit of a cold, but all I do is blow my nose and it stops. Most of the time my nose is dry and clear and open, and it's amazing. I can sleep laying down fully, and I don't have to sleep sitting up to be able to breathe. But yeah, speaking of sleep is a bit iffy. So I would say I was 100% recovered on Christmas. So Christmas was 1 month. Christmas Eve was exactly 1 month after surgery, and I'd say that was when I was fully healed. That was when I completely stopped discharging. My throat pretty much had stopped hurting all the time, and everything had gone back to normal. So I was sleeping like a log, and I mean, I would go to bed at about 9:30 at night, and I would be asleep by, I would get into bed at 9:30 on the dot, and I would be asleep by 9:35, guaranteed, every night. And I try and maintain a like routine of going to bed at the same time every day and waking up at the same time, because I think that just helps regulate yourself. But yeah, I would go to bed at 9:30 every night, and I would guarantee to not wake up till the next morning. I would not roll over and wake up and then go back to sleep. I just would not wake up. I would sleep like a log, and it would be even worse. Like, the weekends I was at my dad's, sometimes I would have, you know, Sunday morning off. I wouldn't go to work Sunday mornings. Like, I'd have Sunday off, or I would work Saturday night instead of morning, and we'd sleep in till 10:30, 11 o'clock, and I would go to bed, say at 9:30 the night before, and I wouldn't wake up till 11, 11:30 the next morning. So I was getting so much sleep. I had so much energy all the time. It was amazing. Everyone was saying, like, you're a different person. I was insane. I was going for walks all the time. I was starting to lose weight. It was incredible. Now, I'd say at the beginning of April, that has all changed. I am falling asleep, but I don't think I am sleeping, if that makes sense. I am, each day, I'm just feeling worse and worse and worse. I am constantly getting headaches. I don't know if it has anything to do with the surgery or if it's something with me, but I've been getting excessively like sweaty of a night. I find I am so hot, and yeah, so we are going to talk to my doctor about getting me a sleep study, because I am just waking up every morning feeling worse and worse, and it's something that's happening in my sleep. So yeah, seeing if I have any sort of sleep apnea, or if there's any sort of seizure activity, anything, or even if I'm getting up and running around the room in my sleep. We don't know, so it's a good idea to get that all tested, just to rule anything out. Maybe it's just me, maybe there is something going on, I don't know. But yeah, to go along with all of that, my heart still hasn't really settled down. I think I mentioned at the beginning of the video, definitely, and in my other video, my 2-week update, that I was, my heart rate was still really high. I was still resting at about 110-ish, and my doctor visits our house like once every 3 weeks. He always tests my heart rate, and every time now he still says my heart rate's still about 110. So we're not sure if I just have a naturally higher heart rate, or if something has happened when I went into cardiac arrest and it just hasn't come down, because no one actually recorded my heart rate before. Like, they took my heart rate, but they didn't write it down pre-op. So we don't have a record of it, and after everything that happened and them having to bring me back twice and things like that, no one could remember what it was. So that's a little bit of a worry. I'm finding in my lungs and my chest, I'm finding it a bit hard to breathe. I just feel like I want to sit here and do this all the time. I'm getting slight like lightheaded, dizzy spells as well. My head sort of feels a bit weird all the time, which is another reason why the sleep study is good, to see if there's any like electrical seizure activity going on. I mightn't be actually having seizures, but I might have that excessively electrical current through my brain. I'm probably weird. My cat's sitting on my bed glaring at me. So yeah, we are talking about getting that done. But yeah, breathing. I can't sing a full song anymore, and not that I can actually sing. Stop! Not that I can actually sing, but I mean, I used to have enough air in my lungs. I could sing out a song the whole way. Tinkerbell? My cat is wrestling everything that's on my bed right now. So, are you right there? Stop it! She's going to town. I'm gonna leave her alone. So yeah. But now those really long notes, I used to be able to belt them all out, do it, and I would still have enough air at the end. I find I can't even get enough air to sing half a song, let alone a long note, and it's, yeah. I'm not sure if my asthma's been aggravated, because I used to have asthma when I was little, or what, but yeah. So that's me 6 months post-op. Breathing is amazing, in my nose at least. My throat has healed. This surgery's literally changed my life. I'm sorry if you can hear my cat. My surgery, that has literally changed my life. I can breathe. I'm not sneezing all the time. I don't feel constantly sick. I'm able to actually do things. Are you right there? You're gonna tear my mattress apart. You are. And, yeah, if anyone needs to have this surgery done and are second guessing themselves, you are really silly. I'm sorry. If you need to have your nose fixed in the way that I did, do it. I had a very, very easy recovery. I was in little to no pain. It was mostly very slightly uncomfortable, not even pain. My cat's made herself under my doona, in between my sheet and my doona. She's an idiot. Yeah, I had little to no pain. Recovery was amazing. I took my bandage off like 3 days post-op. I was able to put makeup on 3 weeks after surgery. I can now smell things. I can wear perfumes, I can wear deodorants, aerosol cans don't bother me, things like spray deodorants. All teenagers here, it seems to be, they are obsessed with spraying deodorant. I know some people who were friends of mine in high school, they would go through a whole can of deodorant in a week because they would spray that much on themselves, pardon me, all day every day at school. And those would nearly kill me. Like, my nose would swell up so bad. My throat would burn. I would literally feel like I was in the middle of an anaphylactic attack. But now I can go near it. I still don't like the smell of them, but I can go near it. I can smell it and don't feel like I want to die. I can smell cooking, like food cooking. It's amazing. My sense of taste has heightened as well now because I can smell things. But yeah. My life has been changed for the better. There are some downsides to this, but like obviously my heart not settling down, the fact I can't breathe right now, but that may be something that's totally unrelated. My cat has completely messed my bed up, so I need to go. Yeah, so thank you for watching, everyone. Comment the word cat in the description box down below if you sat through this whole video, because I know it's boring to some people, but to me I think I need to get it out there because there's not many people who I have come across where I can hear their stories. So yeah, all information I want you to know will be in the description box down below, so please feel free to check it out. I'm gonna go make dinner in a minute because my mum's not here. That's one of the reasons why I'm filming this. And then I'm gonna go have a bath and maybe completely destroy my cat because she's destroying my bed. Aren't you? Come and say hello. Come here. She just wants food. That's all she ever wants is food. Because she's a grumpy cat. We've labelled her Grumble Bum. So yeah, before my cat destroys everything, I'm gonna go. I do upload videos on a Thursday night, Australian time. I don't have a specific time, it's just, like, don't eat that. It's just whenever I go to bed, I click upload. Usually it's around 9:30. We have recently just upgraded to our NBN network as well, so last week's video uploaded in like 20 minutes. That was so weird. So I'll see if this one does. So yeah, stay tuned for somewhat different backgrounds. Next week's video is going to be a get ready with me, unless I choose to upload it on Saturday if I'm feeling generous. But yeah, thank you for watching everyone. Please subscribe and I'll see you next time. Bye!